Welcome to SpaMedicaTV TV. My name is Dr. Stephen Mulholland. Good to see you again. Very, very common problem. People who have nasal-facial disproportion. The nose doesn't match the inherent features in their face. There's some non-surgical options. Please check out our TV episode on the 5-minute nose job. Many people, however, want a surgical correction of their nose. I've done a lot of rhinoplasties or nose jobs over the last 15 to 20 years. So why don't we watch this segment and see one person's story and approach to this.
To CityLine. At the start of the show, we told you about the injectable rhinoplasty, but before we show you the results, we're going to show you a surgical rhinoplasty. Take a look at this.
Shannon, Dr. Mulholland's ready to see you now.
Okay, thanks.
And so your profile shots bother you the most, and our goal is to take that bump that has been with you now for a very long time.
Yes.
And to reduce that bump.
I'm happy where I am. I've got a great job. I'm engaged. I've got my wedding coming up next year. And, you know, I thought now's the time better than ever to enhance something that has been bothering me for years. I'll deal with it. Maybe I'll fix it. No, I'm going to deal with it now. I'm going to finally enjoy my profile, stop throwing out all those pictures of my profile that I hate. And basically all I'm really doing to me is I'm going to like my nose.
What we're going to be doing is approaching her nose through a procedure called a rhinoplasty, or common parlance would be a nose job. And what she really, really dislikes is her profile, her side shot. And so she finds that she's very self-conscious when she thinks people are looking at her from the side, doesn't like taking pictures from the side. And this is a hereditary overgrowth of cartilage and bone on the bridge of her nose. She's got a very strong bridge. And it really detracts from some of the angular, pleasant features that she's got. And so what we'll be doing is we'll be shaving down and chiseling, much like sculpting, the bridge of her nose. Now the trick is, of course, to leave it still looking narrow and natural and not over-reduced because that 1970s ski jump appearing bridge is just not very popular right now. And her stated goals really are, Shannon's goals are to look natural. Shannon,
Hi,
good to see you again.
You too.
How have you been?
I'm fine.
You're looking great.
Thank you. The overall results I'm thrilled with. I'm thrilled. I no longer feel intimidated by my profile. I like how I look in the mirror. I did before, but now I have a new way of looking at myself. It's a bonus. I liked myself before, and I just didn't really like this bump in my nose, and I really am pleased with the way that I'm still me.
Well done. So that's great. That's great. Now, the swelling of that takes some time. I mean, first of all, when you take a look at the nose, it looks a little battered there for a while.
It does.
And that you showed us about 10 weeks later. Really, what is the length of healing time then?
I tell patients that the first, when you get your cast off at 1 week,
right,
you're going to look in the mirror and go, oh my God, he didn't do anything.
Right.
Because it looks maybe sometimes bigger than what you had. But the nice thing about the nose is it settles week after week after week after week. So it starts to look like there's been an improvement by about 6 weeks. By about 12 weeks, it looks really good. And by 6 months, your final result occurs. So you're not going to walk into the office, everyone's go, oh my God, who did your nose? It just doesn't happen that way. It's such a subtle and slow resolution of the swelling that I can't remember in 10 years of doing these that anyone came in and said, geez, everyone's talking about my nose. No. They say, have you lost weight? Or your hair looks good, or something like that.
Yeah, all those things. Which brings me to this point, though. The style of noses have changed over the years, okay? Yeah. They have. Everything's in style. The more natural look, the ski jump. Remember the big ski jump nose? That thing
I
was
trained
really
in the 80s, and everything was that big, you know, Dallas and Dynasty sort of nose job where, you know, it was the giant slalom, basically. It's gone back to a much more natural, women and men particularly just want a bridge that fits their face and doesn't stand alone in isolation, but blends in with the cheeks and chin structure. That's why I use computer imaging, because I go through the computer of what I think would work for them, and they go, oh, I don't think so. Or they go, yeah, that's exactly what I was thinking.
Yeah. Because you as the consumer need to see the vision of what it's going to be like.
Right. You can always imagine if your hips were a little thinner, your tummy was tighter, or your jaws were lifted, but with your nose, you can't kind of go, oh yeah, that would look good.
Now, does the nose keep growing?
It does actually.
Even after you go in there and do some stuff, the nose and the ears keep growing, don't they?
Everybody thinks that, Jesus, 19 and 20-year-olds that have their nose done, probably the most common group of women that I do noses on are in their 40s and 50s, because their cheeks have lost some fat, they've deflated a bit, and what was a happy-looking nose now looks more bulbous and round and Carl Malden-ish, you know, it's just sort of...
Everyone's doing this.
But it does. Your cartilage has life. The sebaceous glands in your skin have life that keeps growing while the rest of you is deflating.
Will I still be able to breathe?
I thought you were going to say pick. Yes.
No, not pick. Well, that too. What the hell?
No, breathing is an issue. So when looking at a nose, even with the injection nose job or the surgical nose job, we start with function. So I look inside the nose, and we do fix function at the same time we fix the appearance.
Okay, and the cost?
The cost in this city would range anywhere from about $4,000 to $10,000. So
what would make it a $10,000 nose job?
Let's say there was some more work to be done on the septum, or maybe some cheek or chin balancing, because some people have a very weak chin and a strong nose.
Oh, so sometimes it's kind of a little bit of a domino effect that you might have to do. Okay.
Right, balance the 3 points, cheek, chin, and nose, so the triangle looks normal.
Okay, and then I know in your office, but a lot of doctors are now picking up on your lead, and that is you can do time payments. Yeah. You can. So you don't have to be saving the money, you know, all at once. So there's a down payment on my nose.
There is. About 5 years ago, I thought, well, no one's doing financing. And in reality, probably about 50% of patients now treat their cosmetic surgery like a car.
Yes.
They say, well, I'm going to use someone else's money at a reasonable rate, pay for it for 5 years, and then see what other model I want.
Yeah, exactly.
And it's become much more of a affordable.
Dr. Stephen Mulholland, everybody. Good information. Check it out. Consultations cost a little bit. But what I want to say, too, is when you go to a reputable doctor, it does cost for consultations. Then you take that information and you think about it. No one's pressuring you into do it, right?
Absolutely.
Okay, nice to see you again.
Good to see you again.
We'll see you soon.
when you're old enough. When you're old
What do you think? What do you think?
A couple years.
A couple years. Good. Good news. He can come back again. We're going to take a break. We'll be right back.
Wow, nice result. Surgical rhinoplasty can be just that, a nice restoration of balance and proportion between the nose and the face. How do you know what's the right outcome? How do you make a decision? Come in and see me at SpaMedica or check out SpaMedica.com. I always do computer imaging. Using a computer, I walk you through the procedure of a rhinoplasty. I show you what I think after 15 to 20 years of doing this, you should be able to achieve. And that leaves many, many people feeling very reassured that they're going to get what they want. So come in and see me. I'm looking forward to helping you achieve the nasal facial balance and proportion you're looking for. Thank you very much.